Why does raw cause morning stiffness? Imagine waking up after a long night and your joints feel stiff, sore, and hard to move. This common experience in rheumatoid arthritis is actually a sign of ongoing inflammation in your joints. In rheumatoid arthritis, your immune system mistakenly attacks the lining of your joints, called the synovium. This causes inflammation, swelling, and pain. When you are inactive during sleep, this inflammation builds up, making your joints stiff when you first wake up. One reason for this stiffness is that the inflamed synovium becomes thickened and produces extra fluid and inflammatory substances like cytokines. These substances cause swelling and restrict joint movement, especially after periods of rest. During sleep, because you are not moving, the synovial fluid in your joints can become thicker and more viscous, which reduces lubrication. This makes your joints feel stiff and less flexible in the morning. As you start moving during the day, the fluid redistributes, and the stiffness begins to improve. Muscle inactivity during sleep also plays a role. When your muscles around the affected joints are not active, they can become stiff, adding to the joint stiffness you feel in the morning. Additionally, research suggests that in rheumatoid arthritis, there can be impaired breakdown of fibrin deposits, protein networks formed by immune cells in the joint. These deposits can physically restrict joint movement and contribute to prolonged stiffness. Morning stiffness is also linked to systemic inflammation, which means inflammation throughout the body. During the night, inflammatory markers like C-reactive protein, and cytokines tend to be higher, making the stiffness worse in the morning. The severity and duration of this stiffness often reflected how active your rheumatoid arthritis is. More active disease usually leads to longer and more intense morning stiffness. In essence, morning stiffness in rheumatoid arthritis results from a combination of immune-driven joint inflammation, changes in joint fluid, muscle inactivity, and possibly the buildup of inflammatory proteins. As you start moving and your joints warm up, the swelling and fluid distribution improve, easing the stiffness. This symptom is an important sign that your disease is active and needs proper management to reduce inflammation and protect your joint function. Always talk to your healthcare provider to develop a treatment plan tailored to your needs and to better understand your symptoms.